finishing up with Chapter 12, Objective 7, we're going to interpret the meaning of abbreviations related to the eye. Again, there's only a handful of these. Just pay attention to when letters are capital when they're lowercase. So what abbreviation is used to denote the progressive deterioration of the macula associated with, for example, central vision loss as depicted below? So first you have to know what disease this is, and then of course the abbreviation that goes along with it. So hopefully the disease you are thinking of is age-related macular degeneration, which is abbreviated ARMD, all caps. And then the abbreviation for blurred vision caused by irregular curvature of the cornea or lens. Light refracts improperly, resulting in diffused rather than points of light focusing on the retina, and that's going to be an astigmatism, which is abbreviated AST. So let's go over Objective 8, which is applying medical language in clinical context. So we're going to read the scenario and answer a few questions pertaining to it. An elderly gentleman visited his ophthalmologist because of decreased vision. Tonometry examination showed borderline readings. Visual acuity measurement indicated a mild degree of myopia and presbyopia. A diagnosis of glaucoma is suspected in this case, and travoyl eye drops were prescribed 1 drop daily. A cataract of the right eye was found. Lens implant surgery, which places an intraocular lens, will be performed when the cataract matures significantly. Approximately 5 years ago, the patient had a retinal detachment of the left eye. A sacral buckling procedure was performed and was successful in halting the progression of retinal detachment. So, true or false? The ophthalmologist used an instrument to measure pressure within the patient's eye to assist in the diagnosis of increased intraocular pressure. And that is true. And then number 2, visual acuity measurement indicated what? So just read those options, and hopefully you are picking letter B for nearsightedness and impaired vision as a result of aging. Number 3, travoyl eye drops were prescribed to address symptoms most likely caused by what? And that is going to be letter B, also optic nerve damage caused by increased IOP. And number 4, true or false, a sacral buckling procedure was used to correct clouding of the lens of the right eye. And he had that procedure done, but it was not for the clouding of the lens, so that's going to be false. It was used for the detached retina, not the cataract. And that will end this recording. You can now go to eCampus to complete the activities.